tuberculosis, also called TB, consumption. A potentially serious infectious bacterial disease that mainly affects the lungs. The bacteria that cause TB are spread when an infected person coughs or sneezes. Most people infected with the bacteria that cause tuberculosis don't have symptoms. When symptoms do occur, they usually include cough, sometimes blood-tinged, weight loss, night sweats and fever. Treatment isn't always required for those without symptoms. Patients with active symptoms will require a long course of treatment involving multiple antibiotics. Requires a medical diagnosis. Most people infected with the bacteria that cause tuberculosis don't have symptoms. When symptoms do occur, they usually include cough, sometimes blood-tinged, weight loss, night sweats and fever. People may experience pain areas, in the chest. Pain circumstances, can occur while breathing. Cough, can be chronic or with blood. Whole body, chills, fatigue, fever, loss of appetite, malaise, night sweats, or sweating. Weight, severe unintentional weight loss or weight loss. Also common, loss of muscle, phlegm, shortness of breath, or swollen lymph nodes. Signs and symptoms. When a person's immune system is weakened and he is exposed to TB or has latent TB, then the disease becomes active. The bacteria then begin to war against the body, and destruction can be rather severe depending both on the level of the person's immunity and the location of the bacteria. The respiratory system is the most common place where the bacteria grow. One of the most common symptoms of tuberculosis is cough, which becomes persistent and is accompanied by phlegm and even blood. The coughing becomes more and more prominent with time. The patient becomes weak, loses focus and suffers from fever and sickness often. One of the common TB disease symptoms is chills and night sweats. The patient gets in and out of fever and feels uneasy most of the time. Even during cold weather, night sweats becomes a common phenomenon. A very common symptom is loss of appetite. A person suffering from tuberculosis has drastic appetite loss which apparently leads to a loss in weight. The person becomes skinny, looks weak and out of strength. Like a cycle, this loss of strength helps the disease to spread faster as the immune system becomes more and more weak and the bacteria becomes stronger. Chest pain is a symptom of tuberculosis which causes a great deal of uneasiness to the patient. The activity of breathing becomes more and more difficult with time as the membranes lining the lungs get infected and inflamed by a condition known as pleurisy. Other symptoms like swelling of lymph glands and other joints of the body impairs movement. In its active state, TB kills approximately 60% of those who go untreated. Worldwide TB kills approximately 3 million people every year. Annually there are 20,000 active cases in the US alone. At one time TB was the main cause of death in the US. Medication for this disease has only become available since the 1940s. Before that time it was called consumption and people with this disease were isolated in remote sanitariums to prevent it from spreading to others. In addition, TB results in abnormal chest X-rays and lab results. It also must be remembered that a person with active TB can spread it easily to others nearby. Adequate ventilation is a must. Since the disease is highly contagious, a healthy person meeting or visiting a patient of TB must be on his guard at all times.